The COVID-19 pandemic and resulting economic downturn has negatively affected many people's mental health and created new barriers for people already suffering from mental illness and substance use disorders. In a recent KFF poll, nearly half, 45% of adults in the United States reported that their mental health has been negatively impacted due to worry and stress over the virus. As the pandemic wears on, it is likely the mental health burden will increase as measures taken to slow the spread of the virus, such as social distancing, business and school closures, and shelter-in-place orders, lead to greater isolation and potential financial distress. And I got this from KFF.org. The COVID-19 pandemic has likely brought many changes to how you live your life, and with it, uncertainty, altered daily routines, financial pressures, and isolation. You may worry about getting sick, how long the pandemic will last, and what the future will bring. Information overload, rumors, and misinformation can make you feel out of control and make it unclear what to do. During the COVID-19 pandemic, you may experience stress, anxiety, fear, sadness, and loneliness. And mental disorders, including anxiety and depression, can worsen. The source I got this from was mayoclinic.org. In public mental health terms, the main psychological impact to date is elevated rates of stress or anxiety. But as new measures and impacts are introduced, especially in quarantine and its effects on many people's usual activities, routines, or livelihoods, levels of loneliness, depression, harmful alcohol and drug use, and self-harm or suicidal behavior are expected to rise. In populations already heavily affected, such as Lombardy and Italy, issues of service access and continuity for people with developing or existing mental health conditions are also now a major concern, along with mental health and well-being of frontline workers. As part of its public health response, WHO has worked with partners to help develop a set of new materials on mental health and psychosocial support aspects of COVID-19. The source I got was World Health Organization.org. COVID-19 has caused many people to have a big fear of getting sick, has led to an increase of depression, and is very overwhelming among all of us, and can cause fear and worry and difficulty in sleeping and concentrating, which is very stressful for children and adults.